We've all heard the phrase size matters, and when it comes to breasts, it really does. A new study shows that American women have the largest natural breasts in the world, but yet breast augmentations are still the most popular cosmetic surgery there is. How do you explain that?
Oh, we also have some of the largest amount of obesity as any other nation in the world. But if you look at breast augmentation size and you start to think about what's appropriate and what fits that patient, I think it is a little bit geographic. I think that you have patients who are out in the sun and in the beach all year round versus my more professional women who may be more covered up in the Northeast.
I would agree with the obesity, but there's a lot of regional and just difference country to country in terms of breast size, but it really comes down to what the woman really wants anyway.
You're right. A recent breast symposium, I believe, in Las Vegas showed that, in the Northeast, Manhattan, women want smaller breast implants, whereas in the South, women still prefer larger breast implants.
It's somewhat regional. It's just really comes down to the patient and what they want, whether they want proportion or whether they want restoration or whether they really do want a larger breast.
But one of the things we do know is that if you want to have a long-lasting outcome, if somebody's going to pay for breast augmentation surgery and they want to be a certain size that doesn't fit into their proportions, I think it comes down to patient education. Show that woman what she might look like in 2 or 3 years when that breast falls, because gravity is real, and she may reconsider those thoughts about getting such an oversized implant.
She might, but she might not. But it is important because different breasts and different women are going to age differently. So you can talk to them about that.
Because don't women sometimes then when they come back, they get a certain breast size on the first surgery and then they think, oh, it's too small, and then they come back for a larger breast size.
I think that's a myth. I think patients always say, I read online I should go a little bigger than I want because in 6 months I'm going to wish I went bigger. And then again, I show those patients, all right, fine, do you want ripples on the side? Okay, do you want that to bottom out? And the chances are if you're oversized with a heavy implant, those are trade-offs. If the patient says, I don't mind a little ripples, I want cleavage, fine, that's where you said patients may want something. But they have to understand there's a trade-off to that decision.
Well, for all you need to know about breast augmentation, be sure to visit theplasticsurgerychannel.com.